So thank you guys so much for your questions. We have lots of them. So I'm just going to go ahead and just go straight for it. Is there an air quality level that you should take as the meaning of do not exercise outside?
Yeah, there's a limit of 25 micrograms per cubic meter that's established as, and that's measured over a 24-hour period. So that is a typical number that's out there. You can see that number published on the MOE website. And that is a typical threshold for really starting to reduce your outdoor activity. So that would be a go-to number. If you're more sensitive to smoke and irritation, obviously it's going to be a common sense decision, but that would be the one standard that I'm aware of. There is an MOE website. It's great, BC Air Quality, and they'll have a map of the whole province. You'll be able to zoom into your area and pick the closest air quality testing station, and it will give you that 24-hour breakdown of the number that that station is experiencing.
So is that at Langdale?
Yes, that's at Langdale Elementary. But also that Purple Air website as well, they'll have good averages for your localized neighborhood as well. There's multiple Purple Air sensors all over. It's at people's residences when they decide to purchase one of these Purple Air sensors, and they all communicate to the Purple Air website. So yes, Sechelt Gibsons were surrounded by people that have these Purple Air sensors. There's lots of them in the map that I saw. So, yeah. Okay.
And there are a number of references today from various sites and information. We will do a summary for you and post that on our website. So there's lots of great information from your presentations today, and we'll do a quick cheater link, if you will, on all the different resources you can go to. There's a question here. Has there been a change in people's lung or airways after having COVID? And can you speak about that and how it's evolved?
So there has been a huge investment by the Government of Canada to start to actually answer that question. So there was a number of long COVID clinics that there was a couple in Vancouver Coastal, but throughout BC. And people that had ongoing symptoms after a COVID infection, say 2 to 3 months after, were referred to these clinics. And so over 7,000 people were able to attend those clinics. And from data like that, and from the information that was received from that, and also these clinics all over Canada, they've created a long COVID network. And so those are doing spirometry tests, and they're also doing CT scans to try to get a sense about what happens after COVID within the first year, and then does it start to resolve, because it's a great big unknown at this point. So it's hard to know. It's only 3 years past, but they're actually following people over time to try to get an answer to that question.
There's a number of questions here about what if people do not have a family physician here on the coast? And thank you everyone who submitted that, because there's or a nurse practitioner. So if you are experiencing some of these symptoms, having a hard time finding that straight answer, or even someone to help you with that assessment, what should the community do? Kala? You're nodding.
It's the unfortunate. Any physician can refer you. If you were to go on a walk-in basis or do one of the same-day bookings at any of your health clinics with a GP, and expressing your concern and your symptoms, any of them would just be pleased as punch to send you on to get a spirometry done. You're not going to really have to argue your way into getting one. So doing a more walk-in type test, if you're already seeing any kind of specialist, they would be happy to send you one to have a spirometry or a breathing test done as well. Do you have anything to add on, Ron?
Well, I suspect that Babylon, the TELUS Physicians do referrals. I've spoken to a few of them over time as well. I don't know whether they can refer to us, but presumably.
I think the Doctors of BC had listed on their website that all the clinics on the coast are saving spots for unattached patients. So if you call the morning of an appointment, you will be prioritized being unattached.
Okay, just to change things up here, can we talk about pot smoking and vaping? Why not? And how that's actually impacting lung health and airway health, and why aren't we talking about it more? Ron?
Oh, boy. I think Dr. Sin at St. Paul's has done a fair amount of research on pot smoking and lung disease, and it's very clear that any smoke damages lungs. Being as those who smoke pot tend to hold it in and keep those 2.5 micron particles into the lung rather than just spewing it out on their neighbors, because they want every bit of it, they're more likely to get damage from a smaller amount. We don't exactly know. I mean, it's been a difficult research project until marijuana became legal, in that, do you still beat your wife is not a good question to ask in a usual clinic. Do you smoke pot? Well, a lot of people would not have admitted to it. So vaping as well, there's some very specific lung diseases that happen with vaping called popcorn lung, where the solvents that carry the flavors can basically dissolve lung tissue. And once that lung tissue is dissolved, it doesn't recover.
I agree, and it was suggested that vaping could be a way for people to quit smoking. And so the tiny little proportion of the population that really could not quit smoking, and it was almost like a transition to be able to move from being a heavy smoker to vaping. And unfortunately, that hasn't really happened. Many people have maintained their smoking habit, and of course now we have kids and and young adults that are taking it on that never would have dreamed of starting cigarette smoking. But all of the flavors and the different mechanisms have just created a potpourri of unknown, and so I don't think we're really not going to know for probably a couple more decades about the impact of that.
In one of the presentations, you talked about inhalers, and can you explain how the inhaler works when you mentioned something about opening up your lungs? Does that involve steroids? How does it work? How do you determine the dosing? Like, how do you get into an inhaler, and how does it work?
Great question. So there are many inhalers. The one in particular that we use as a part of the test is called Ventolin or salbutamol. It's that lovely little blue one that I was saying that most people at some point have probably seen. It's what we call a bronchodilator. So broncho being in your lungs, dilator being makes it bigger. So what it does is it works on those lovely breathing tubes that go down into your lungs. If there is any tightening or constriction in those breathing tubes, it works on them to help relax them and open them up. That being said, if you do not have a breathing issue, your lungs are already as open as they're going to be, it's not really going to do anything at all. Anybody with that tightening or constriction in their breathing tubes is going to see a benefit, and those tubes are going to open up and relax, and then we will see a benefit doing the test after that. As for other inhalers, there are different kind of mixtures depending on what you need. So the bronchodilator that we use as part of the test has no effect on inflammation. That you can use inhaled corticosteroid. There are many of them. They also have mixtures of them where they are combined. They have longer acting ones and shorter acting ones. And that is which one you should be on, if you should be on one would be prescribed by your doctor depending on the mechanism of what is going on in your lungs. If you would benefit more just from controlling the inflammation, or if you would benefit more from opening up those breathing tubes. And then also, or both, of course, is there's an option for that too.
Back over to you, Darren. Is there such a thing as like a healthy house audit where someone comes and figures out your carbon monoxide and your radon and your particulate matter? Does anyone do that, or do you?
That is not a publicly funded service by VCH, but there are home inspectors out there that will touch on many of the components of indoor air quality. I'm sure if you Googled, you could find a consultant to come in from Vancouver to a Sunshine Coast house to do more of an extensive healthy home assessment. I don't believe there's any services locally on the coast. But yeah, it's not a service that Coastal Health offers, but I'm sure they're out there.
Joanna, you're remarkably quiet. Are there any questions that are burning in your head? Because you're really good at this.
Well, I'm just thinking back to masks. I know you said the N95 mask. Is there any benefit to us wearing the old blue paper masks?
I recall reading on the BC CDC website, they were saying N95 is best, and there is still some protection based on a cloth mask that would be beneficial. It'll be quite a bit less than an N95. Again, it depends on the fit, but it's not like it's completely useless, but there is some protective effect, and that's what the BC CDC seems to be publishing regarding PM 2.5.
Yes.
Just while he's still there, about radon, you were talking about that. Is there certain geographical areas where radon is more prominent?
Yeah, in the interior of BC, around Trail, for example, that's a radon hotspot. Mostly on the Sunshine Coast here, we're doing okay because it's a bunch of glacial overburden and sediment. It's when your house is sitting on bedrock that tends to be a bigger issue. But don't guess. Get one of these cheap detectors and do a 3-month test through the winter season on your ground floor and see where it's actually at. So Texada is a big rock, and we found a few elevated levels out on Texada Island at the elementary school out there. So just depends on the geology underneath, and the test will tell you one way or the next.
Is bedrock, would that be granite? Or?
Granite, bedrock, yep.
So where do you get the radon detectors again?
I'm pretty sure the BC Lung Association has some resources to getting one. The company's called AccuStar, and they're based in the States, but they will mail a detector to you and for your 3-month test, and then you mail it back to them. So there's links out there for how to get one of these detectors. $30, $40, that sort of thing. That's the cost you're looking at for a 3-month test. And so an online search you'll come up with those pretty soon, but AccuStar is the name of the company that is the most prominent with that.
Yes.
I was just wondering, does it have to be a 3-month test? There's nothing that can tell you like now if you have a problem with radon?
Yeah, a snapshot test is only going to tell you a snapshot. A really good assessment as to what you're actually breathing over the longer term, especially through the winter months, it's going to be a 3-month test to apply some averaging. Little spikes can happen, and it just may not be useful enough to make health decisions on as to whether I need to renovate or get more ventilation going through. So.
Yes, Courtney.
So if you get a recommendation for a spirometry, how long is the waiting list?
Yeah, it depends on the acuity of the situation. So if you were being sent for pre-operative testing, you could be tested within a week. But if you're run-of-the-mill cough that won't go away and you haven't been diagnosed, it might be 5 or 6 months at this point. Although we're hoping with the new services that things will change in the new year. So it's a little bit tentative at the moment, but it depends on the level of severity.
So those new spirometers you're going to be getting, that will shorten the...
Yeah, so there's lots of issues involved. Space is one of the issues, so it's not just about equipment, but about where do we do this test in a way that's safe for everyone. There are air quality issues with spirometry, COVID days, and we're not through it, unfortunately. And that was true of all the labs across the world. Things were halted during COVID, and that certainly has contributed to the backlogs. But access to spirometry is an age-old problem. This is not new news. So we're trying to do our part, and thanks to Pat's team too, it's becoming more of a focus.